Association, Wisconsin Hospital Association. Watch WisconsinEye on Spectrum Channels 995 and 363 and at wiseye.org.
All right, hello everyone. It is just after 3:30, so I think that we can get started. Thank you all so much for taking part in this call. Can you all hear me all right?
Yes.
Yes.
Yep. Sorry, got a strange echo. This is Elizabeth at the Department of Health Services. Thank you so much for taking part in this call. Obviously talking about the brief filed on behalf of healthcare providers, healthcare workers, religious leaders, in support for Safer at Home and Badger Bounce Back. On the call today, we have four folks who are ready to talk to you. Dr. Jim Conway, a professor of pediatrics at the UW, Jeff Mandell at Stafford Rosenbaum, Reverend Nick Utfall of the Advent Lutheran Church, and Chief Legal Counsel Ryan Nilsestoon with the Office of the Governor. And Ryan will begin our call today.
Thanks, Elizabeth. So again, this is Ryan Nilsestoon, Governor Evers' Chief Legal Counsel, and appreciate everybody taking time today. As the Governor talked about, if you were on the call I guess not that many minutes ago, in his remarks, he mentioned how Wisconsin's pandemic laws, just like every other state of the nation, give the state health department, in this case the Department of Health Services, broad powers to combat pandemics. Wisconsin, just like 41 other states, have used these powers to implement safer at home orders in order to deal with, once-in-a-century pandemic of dealing with COVID-19. And these orders have been successful throughout the country, and especially here in Wisconsin, in bending the curve and saving lives. Unfortunately, as we've seen and what has become an all-too common experience lately, instead of convening and passing legislation or trying to put forth their own plan, the Wisconsin Legislature, once again ran to the Wisconsin Supreme Court last week, this time to ask the court to block Safer at Home and require the Department of Health Services, instead of taking immediate action, instead of responding quickly, the legislature is arguing that the Department of Health Services has to go through the administrative rulemaking process, which is, just like the name sounds, is a complicated, time-consuming, cumbersome process that can last anywhere from 20 days, or if there's objections or other hiccups, can last much, much longer, even for a so-called emergency rule. And as you saw in DHS's brief filed by the Department of Justice yesterday, we're confident that the legislature's argument is wrong on the law, it's wrong on the facts, and it doesn't line up with a long line of past cases, both in Wisconsin, in other states, and in the U.S. Supreme Court. That said, what's different with this lawsuit, though, today, is that today you're going to see an unprecedented number of amicus briefs filed with the Wisconsin Supreme Court in support of Safer at Home. And I think what's really incredible about this is just how very diverse these groups are, of individuals and associations and organizations. And collectively, they represent hundreds of thousands of Wisconsinites, thousands of medical professionals, and thousands of other people in Wisconsin who are impacted by the pandemic. And so you're going to see briefs from people representing everyone from frontline workers like nurses and transit workers to doctors and medical experts to tribal nations and local governments. And they also include religious organizations like the Wisconsin Council of Churches and associations representing Wisconsin's local public health officials. And they're all going to be, they're going to be bringing their own unique voices to this lawsuit. They are all speaking with one voice, and that is that Safer at Home is working, is saving lives, and is the best and most effective tool we have to save lives in the COVID-19 pandemic. And so on today's call, we have some of the people who filed amicus briefs, and they're going to be talking about why this case is important to them, their organizations, and communities. And while I'll be available to hand over to answer calls later, I think it's important that we hear from some of these folks since I'm usually on these press calls lately. So first will be Jeff Mandell, who filed an amicus on behalf of a number of leading Wisconsin healthcare associations and more than 50 Wisconsin doctors and nurses. So Jeff?
And hello, everyone. I did file a brief today that includes Dr. CONWAY, who's on the call as well. And that brief had two purposes. One was to bring science to the forefront and help make sure that the court fully understands what is known and what is unknown about this current pandemic. And the second was to illustrate, using that science, some of what Ryan was saying a minute ago, which is just that the emergency rulemaking process that we have under Wisconsin law, while it is good for many things, is fundamentally incompatible with responding to a pandemic or an epidemic situation like this, where facts are changing so quickly and danger is so severe. I just want to take a quick step back and talk about amicus briefs for a second, and then I'm happy to turn it over to others and answer any questions people have. But when we talk about these kinds of briefs that were filed today, these are friend of the court briefs. These are briefs filed by organizations, people, and who are not part of the lawsuit. But they come to the court because they believe that their experience, their training, their expertise, their lived experience sheds particular light that will help the court understand the full nuances of the case before it and help it make a wise and just decision. And so that's why, as Ryan talked about, you have a number of different briefs that were filed by a number of different communities and categories of organizations and people. And it is pretty amazing how, with very little time, given that this lawsuit was indeed filed just last week, so many came together. But lots of these briefs are focused primarily on facts. They do contain legal argument, but their real goal is to explain a nuance or a corner of the situation that the court might not otherwise hear about from the parties.
All right, Jeff, thank you so much. And Dr. Conway, did you want to open with remarks, or would you like us to go right to questions?
I can make a few short remarks. I just wanted to make it clear to everybody that, as far as we're concerned in the medical community, this is a non-political issue. This is an issue of public safety and public wellness. And, recognizing that we're in a historic outbreak, and, while we've been through versions of this before in 2009 with the H1N1 pandemic, where we were fortunate to have vaccines and antiviral agents readily available, and while we prepared in 2014 for the possibility of Ebola, this is really unprecedented in a virus that we've never seen this variant before, that doesn't discriminate really between any individuals, and which is largely still in many ways unpredictable, how this is going to go and how it's going to work out. And I think we've been fortunate to have public health leaders in both the country as well as worldwide recognizing and trying to make best decisions in a timely manner as evidence becomes available. And we were fortunate in Wisconsin to recognize early, based on the experience in other countries, what was potentially going to happen. And acting quickly actually has certainly done a wealth of good to both allow us time to prepare, but also prevent incredible mortality and morbidity in the state population. And I think one of the things that we always need to recognize is, a lot of the plans and responses are based on modeling. And as the famous statistician George Box once said, all models are wrong, but some models are useful. And I think one of the things that's most important to recognize is that, the models that everybody used to try to look at what the possibilities were that could happen, fortunately have not come true because of the incredible patience and compliance of the members of the state. And, from a healthcare standpoint,
as a healthcare worker, having so many of my colleagues and friends who have been bearing the brunt of this outbreak, I think more than anything we want to express our gratitude to the leadership and to the public who have really done a wonderful job of doing what needed to happen to be able to preserve lives here in Wisconsin. What we have to recognize, though, again, is that this is still an unpredictable situation, and really the most important thing we have is public health leadership being able to pivot, be nimble, be able to respond to situations as quickly as possible, and to be able to act in a responsible manner. And then finally, I think we want to make sure that everybody understands none of us are enjoying the situation as it stands. And, as much as anybody, all of our healthcare workers would love to get back to a more normal existence as soon as possible. But we have to embrace the reality of what we've been dealt and recognize that we need to work together to make sure that this turns out as good as it could possibly be. And so part of the reason me and many of my colleagues have joined in this, and I'm happy to discuss it further, is that we just need to have the latitude and the ability to respond to these things in real time to be able to make sure that we maximize the outcome for everyone.
All right, thank you for that. And also on the call, we have Reverend Nick Utfall from Advent Lutheran Church. And Reverend, would you like to say something before we take questions?
Sure. I would just briefly say I'm a pastor at Advent Lutheran, but also on the call as a board member for Wisconsin Faith Voices for Justice. And we have been gathering a lot of religious voices, interfaith voices, lots of Christian voices, but others besides that from around the state, and the ways that we've been addressing it and dealing with the realities of safer at home. And I would just start by saying that for my own Christian tradition, a lot of us are approaching it as a matter of loving our neighbor, and that coming from a commandment of Jesus, and that it has been a real struggle. It's been a struggle for our congregations, and it's an interesting paradox, because it's been a time of such need for people that we are spiritually hungry and longing for answers and longing for the relief that our congregations offer. And it has been more difficult to offer that to people, but we've got amazingly faithful people in a wide variety of ways around the state who have been stepping up and working really hard to be able to offer that resource and that care for congregation members and for communities during this time when we can't gather. And functionally, we would see it that by gathering, we would be doing the opposite of what we're trying to do, that we know it's a difficult time, and so we need the care, and we aren't just going to pretend like it can all go away by getting people back together at churches and other congregations on a weekend.
All right. Thank you so much for that. And now let's open it up to questions. Does someone want to take the first question?
Hi, this is Riley Vetterkin with the State Journal. Can you hear me?
Yes, we can hear you.
Great. So I'm just wondering if the Supreme Court ended up ruling in favor of the Republican legislature in this case, and everything had to go through the administrative rules process, would it be your understanding that we would essentially be living under no order at all conditions would be eliminated, and it would essentially be quote unquote back to normal until administrative rules could be worked out?
Right. Jeff, do you want to do that, or you want me to talk about that? I can talk a little bit, and then Jeff, if you have something else to add. Jeff's brief, one of, I think, the benefits of Jeff's brief when you see it is he points out, I think, quite aptly how administrative rulemaking, and this is coming from somebody I practiced before coming to the governor's office. I practiced administrative law for a number of years, and it is incredibly inflexible in terms of how it responds to things and the number of hoops you have to jump through. And so to your point, Riley, in terms of what it would look like if the court took action, one of the challenges about this type of lawsuit is it throws everything in, it adds uncertainty to everything. And so when we're already dealing with an unprecedented pandemic, We're already working to, setting up testing sites throughout the state, dealing with outbreaks at meatpacking plants, ramping up our contact tracing. We're also having to plan, how the Supreme Court may or may not act in it. So there is a world where a situation where it could be that Safer at Home is struck down. The legislature asked the court to wait 6 days to do so because the legislature believes that that's sufficient time to promulgate an administrative rule. But as both the brief that the Department of Health Services and DOJ filed yesterday points out, and as Jeff's Amicus brief points out on behalf of the healthcare professionals, it's impossible. It takes at least 20 days, and that's assuming the timing works out perfectly in terms of calendar days. That's assuming that nobody objects to the rule. And keep in mind, the legislature in its brief specifically said they want DHS to go through rulemaking, and they explicitly said that if Safer at Home would have gone through rulemaking originally, they would have blocked it. And so that's what I think is so reckless about this lawsuit, is that there's no plan B from the legislature's part. They haven't put out what they would do. They've met once during this entire pandemic. The U.S. Congress, not exactly the most fast-moving body, has passed 4 different bills. The legislature has yet to hold a single hearing on COVID-19. They have yet to introduce any plan. And so that's why I think it's really dangerous what they're asking the court to do. So we're doing everything we can to plan, how to protect life as best as possible, giving an adverse ruling. But I really think that your question points out, how dangerous and reckless this lawsuit is. And Jeff, I don't know if you have anything else to add.
Thanks, Ryan. I would just add, Riley, that there is also a brief that was filed today by municipal public health officers. And, I think it's worth noting, as that brief sort of discusses, that effective pandemic response is a cooperative effort between state and local officials. But we do have another level of governance. It would just be much more patchwork and complicated and far less effective and coordinated.
All right, next question, please.
Hi, this is Patrick Marley. Building on that, one thing I've wondered is if the court were to get rid of the Safer at Home order and the legislature blocked an administrative rule where you didn't have time to put in an administrative rule, would the local public health departments still have the ability to put in orders that were similar to Safer at Home? And would we have potential patchwork where Madison and Milwaukee has one set of rules and rural Wisconsin has a different set of rules?
Hi, Patrick. This is Ryan again. I think what you would see is a 72-county approach. When you cross the county line, there would be a different set of rules. And to Jeff's point on why a statewide approach, why local public health officials support Safer at Home and a statewide approach is because, the virus doesn't respect county lines. Our healthcare system doesn't stop along county lines. And so, Dr. Conway's colleagues, if one county decides to do nothing and the number of cases spikes, that impacts neighboring counties. And that's why, Safer at Home has been effective in terms of bending the curve, is because we have a unified statewide approach and not a 72-county approach where, approach to this. And just think, for example, in some businesses that operate in multiple counties, it's difficult enough in terms of a 50-state approach to this disease, let alone, a 49-state approach, and then in Wisconsin, a 72-county approach in terms of what rules apply where and when. And so I think that's one of the other things that points out how reckless this lawsuit is, to ask the Supreme Court to take, really an unprecedented action like this in the middle of a pandemic and have no plan in place, no legislation introduced, no hearings held, nothing at all. It just shows in terms of how dangerous an adverse decision would be.
Thanks.
All right, and the next question, please.
This is Bruce Connon from the Wisconsin Examiner.
Can you address sort of the constitutional argument that the legislature is making, that it's really their power and not the executive's power?
Sure, and I think this is Ryan again. One of the briefs you're going to be seeing today is from, and the governor's office will be issuing a press release and linking to all these briefs. But one of the Amicus briefs is from a group of about 17 of the leading legal scholars on administrative law and separation of powers law in the country. And so you're going to have professors, some from Wisconsin at UW-Madison, but others, from Georgetown and UC Berkeley and other schools, really showing why that argument is just legally it's wrong. The legislature just gave the Department of Health Services broad powers to deal with a pandemic, and it's similar powers to what every other state health agency has around the country, and other states are all using these powers, and they're passed for very good reason. That's because the legislative process is too slow. The rulemaking process is too slow in order to respond to a pandemic. COVID-19 has exponential growth. Dr. Conway, I'm sure, can talk about how quickly this spreads, but you can't sit around waiting 20, 30 days to pass a rule, or wait, in the case of the legislature, 4 weeks for them to come into session in order to deal with a pandemic. And that's why courts around the country have consistently upheld these laws. Pennsylvania just rejected a very similar argument in their state, I believe, yesterday. And so we're very confident that what DHS is doing is constitutional. It is the perfect example of why executive agencies are tasked with this type of power.
All right.
This is Jeff. Sorry.
Oh, go ahead.
Well, I was just going to follow up, Ruth, and say that you don't need to be. The legal scholars brief that Ryan's mentioning is excellent and is written by some wonderful people, and I highly commend it to all of your attention. But you don't need to be a constitutional expert to understand the basic separation of powers principle that's at play here. The idea was that we had bad experiences with monarchy, where all of the power was combined in one person, and so we separated the power into 3 branches that check and balance each other. The legislature gets to make the law. The executive gets to carry out the law. That is, the executive gets to use the law in real-world circumstances and deal with what's happening on a day-to-day basis. Nothing could be clearer than a pandemic. And the courts get to adjudicate disputes about what the law means if there's a time when there's a genuine dispute and someone has been harmed. In this instance, there isn't really a genuine dispute. No one's been harmed. And what the legislature is doing is saying, yes, we wrote a statute, and yes, it's on the books, but we don't like the way that you're applying it. So instead of legislating and changing the law, we're going to try to micromanage how you, the executive, uses it on a day-to-day basis in a real-world emergency situation. That is not consistent with the separation of powers. What it is actually trying to undermine the separation of powers and allow the legislature to step in and take over executive functioning.
All right, and another question.
Hi, this is Riley again. I just wanted some clarification, if you could, on the administrative rules process. And could you remind us, does that start with the agencies coming up with a rule and then the legislature needing to decide whether it's appropriate, or can the legislature decide what the rule will be and then have it go through that process?
Sure, this is Ryan Olson. So how the rulemaking process normally works is that the agency has to create what's called a scope statement, and they can't work on a rule. No state employee can work on a rule until that scope statement is approved, is reviewed by the Department of Administration, approved by the governor, and then published in the administrative register, which is published once a week. So, for example, if the court rules next Monday, DHS would then, the earliest that scope statement, earliest they could work on that rule would be the following Monday, so they'd have to wait a week in order to start actually drafting the rule. Once they start drafting the rule, it has to again be approved by the governor, it has to be reviewed by the Department of Administration, then they have to, then it gets submitted for legislative review, and that's when the legislature can indefinitely suspend it. So one of the changes in the lame duck laws that are also before the Supreme Court is the legislature gave itself the ability to block administrative rules indefinitely. And so how the legislature typically uses that authority now is they say, we won't approve the rule unless you do A, B, C, and D. So it basically gives them veto authority over rules.
Riley, it's Jeff. When the governor's office sends out links to the briefs later, in the back of the brief by the health providers, you'll find an appendix that has a nifty little flow chart that shows everything that goes into administrative rulemaking and what the time frame is like. But in short, to echo Ryan, there are 8 discrete steps that have to be taken for an agency to get an emergency. This is an emergency rule, so this is the streamlined version of the process. There are 8 discrete steps that have to be taken to get that rule into effect. There are, at almost every single one of them, sort of choke points and veto holds where different actors can say, I don't like this, or I have questions about this, or I want this to slow down, or I want this to change. And it's kind of like a game of chutes and ladders. So anytime someone asks for a change, you basically wind it back at the beginning of the process again. And keep in mind, because I think this is relevant given current circumstances in a pandemic, that even after those 8 steps are complete and you have an emergency rule, there are 4 or more steps that the agency has to take within a fairly short period of time to comply with the statutory process. And then because it's an emergency rule, it doesn't last very long and is up for expiration unless the legislature renews it. And that has its own process, and it can only be renewed for a certain period of time, and then you have to begin the process all at the beginning, even if the legislature wanted you to be able to continue it.
All right, do we have another question?
This is Patrick again. Just a quick one on timing here. So the Republican lawmakers have a chance to file a reply tomorrow, and then after that, it's up to the court to decide whether to take this case, or are there more filings beyond tomorrow?
That is correct, Patrick. They'll be filing a reply tomorrow. Be up to the court on whether to take the case or not.
Got it.
All right, do we have additional questions? Anyone else have a question?
This is Jeff Mandell. Having worked with Dr. Conway and others over the past several days to put together this scientific brief, I will say that even as someone who's a fairly voracious news consumer, I learned a tremendous amount. And if any of you have questions about the science or how COVID-19 works and what we know and what we don't know, I would urge you to ask now, because Dr. Conway is a great resource.
This is Bruce Conner from the Wisconsin Examiner. I have a question for Dr. Conway, and that is, at least in broad strokes, can you talk about sort of the idea of shutting down some parts of the state, Milwaukee, for example, and not others? This is a proposal that's been floated by the Republicans and WMC. What geographic area needs to be closed down within the state in order for stay-at-home to work?
Well, that's part of the terrifying thing for those of us that are infectious disease experts and public health experts is, even having states making different decisions is a little terrifying. If you just want to use one example, the fact that our golf courses opened on April 24th, and yet Illinois' golf courses weren't opening until May 1st, and with the amount of disease they have just across the border compared to how much we have here in Wisconsin, I found it a little worrisome that I could only imagine how many Illinois license plates were going to be coming up over the border to play golf last weekend. And that's exactly how you can introduce disease and have it, introduced into an area that had none or very little disease and see it spread quite rapidly. In the beginning of this outbreak, we were seeing doubling times of, about every 2 to 3 days when there was no social distancing being carried out. In other words, one person would infect a couple others, who would infect a couple others, and the exponential growth, really got ahead of most of the public health authorities in a lot of the places where that happened. And by maintaining social distancing, we get the doubling times, down to something on the order of 10 to 14 days, which gives public health an opportunity to be able to keep up. But if you look at the amount of travel, either for business or recreation, that happens between counties, it's almost like the least common denominator will prevail if you do start to allow certain areas to open more liberally and have other areas still confined, because you know that there's going to be travel and transit between those places. And as we saw with the Green Bay area, it doesn't take much for something to go from a small number of cases to really exponentially exploding in just a few short days, and certainly a couple of weeks. So while early on people argued that the bigger cities, Madison and Milwaukee, would be the sensible places to maintain social distancing, as soon as you get up into the Fox Valley area, or even along the Mississippi and closer to Minnesota, all of those areas have enough people that are in close proximity that spread is to be predicted once a case gets introduced. And so that's why, not only statewide, but these coordinations between states and this idea that states are going to try to do things in cohort together along the East Coast or in the Northeast, along the West Coast, and then this group of states in the Midwest here that's banded together to try to at least coordinate things, is probably the best opportunity to really sort of do this gradually in a way that we continue to move in a linear fashion as opposed to open, close, open, close. And I think that's what everybody is really most interested in avoiding.
All right. Do we have additional reporter questions?
Well, this is Riley again. This question is for Dr. Conway. I am just interested if you could speak again broadly to, what some of the most severe consequences might be if this order is significantly relaxed following action by the Supreme Court. I mean, how much backsliding do you think we could see?
Well, this is an incredibly contagious disease, and so as soon as there's gatherings of individuals, we would expect to see pretty rapid reemergence of hotspots. I think when you look at the risk groups that are the most likely to get severely symptomatic and put pressure on the healthcare systems, we calculate that about a third of the U.S. population actually fits into one of those higher risk groups. If you basically add up population over the age of 60 plus people with underlying medical conditions that put them at higher risk for complications, that's about a third of our population. So you would predict that as social gatherings started again, even limited social gatherings where there wasn't enough knowledge about whether those people in those gatherings were sick or not and shedding virus, you would expect that you would rather quickly, as we've seen in Green Bay, develop hotspots and then pretty rapidly have spread into enough of the population that's at high risk that you would immediately have a surge of cases both in the emergency departments and urgent care centers, but then hospitalizations again. And so I think that's, really the greatest risk. And, as has been mentioned, it's just unpredictable where those things happen. They certainly seem to happen where there's areas where the population is denser, but we've seen in many areas of the country that even in relatively rural areas where there are gatherings, these things can really take off. So that's really what we would predict, is that, until we have the capacity to test enough people and to do what we call contact tracing, to find all the people that they've been exposed to and test them, and then caution the ones that are positive to remain quarantined for a few weeks, we would pretty rapidly, we calculate within, certainly a week to 2 weeks of the lifting of the safer at home, start to see hotspots emerging in unpredictable areas, but mostly would be probably concentrated into more urban areas. But again, unpredictable disease.
This is Nick. I would jump in on that too and say that's part for the religious community why we're particularly feeling the risk and why we're being really cautious and eager for Safer at Home to continue, because we, for spiritual community, we often trend older than the average populations and tend to be some of the bigger gatherings and more sustained gatherings in which people would find themselves on a regular basis, and they tend to be close communities, so people have more difficulty in keeping distance. They're eager to be embracing or shaking hands or being close to each other, and often singing, which we also know is a higher viral load and increases the chance of spread. So for those as religious community, we just feel it's fairly ridiculous to think that we should be part of lifting the order and part of then increasing the spread and the risk of hotspots, and particularly for our own members who might be among the more vulnerable.
Okay, and do we have another question? No more reporter questions? All right, and then I want to thank our panelists, and I want to ask if anyone has a closing statement they'd like to offer that maybe something they weren't asked that they would like to make sure they can get out.
This is Nick. I would just say for the breadth of our brief, the Wisconsin Council of Churches alone is representative of 20 denominational Christian bodies in the state with over 2,000 congregations and 1 million members, and then beyond that with the other individual congregations and broader religious leaders speaking on behalf of their groups, and so it's quite a spread around the state that is feeling this and is supporting it from our perspective.
Yeah, and if I can just add that, while there's a number of signatories to the amicus that was filed on behalf of the healthcare population, this moved quite rapidly, and I guarantee you that if we had time to spread the word and collect more and contact more organizations, you would see pretty uniform support from healthcare and public health organizations. I mean, in many ways, this is largely a common sense issue where, protecting the public in the face of a really unpredictable challenge is by far the highest priority for everybody involved. And so it's been, again, rather heartwarming that not only the population of the state has pulled together and been so willing and compliant to be able to take such an unpleasant task to hand, but that so many organizations have also shared together and worked together to try to do the right thing. And, I think things are moving in the right direction. We're starting to get more information about this disease. We're starting to get new ideas about treatment and better solutions to managing patients. But it really does come down to common sense that if we can prevent this, that saves both time, money, and lives. And this is a preventable disease. We need to do it in a concerted and organized fashion. But I think we've seen that this approach of using testing, contact tracing, and quarantine has been used for centuries. Has been very successful as long as people are organized, careful, and consistent with it. And so I think that's really the message that we're trying to share, is that we need people to be patient. We need a little bit more in the way of capacity and resources, and then we need to gradually do this together. But doing it uniformly makes the most sense. Doing it as a balkanization or piecemeal approach will essentially just allow the explosion of this again, where we'll be back where we started back in February and March. And I think that, as most of us would agree, living the Groundhog Day of doing this over and over again is in nobody's wildest dream something that any of us want to try to deal with.
All right. Thank you all so much. Thank you for participating. Again, media, if you have additional questions, feel free to reach out, dhsmedia@dhs.wisconsin.gov. I want to thank everyone for your time. Have a good afternoon.
Thanks for putting this together.
Thank you, everyone.
Hi, I'm John Hinkins, WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted, gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes with a gift of any size, it will provide a huge boost. So thank you. To donate, please text WisEye to 44321. That's WISEYE to 44321, or visit wiseye.org/donate. WISEYE.org/donate. Or you could send a check to 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.